Community Pharmacy Division. With 4 years of decades of experience into academia, research, and pharmacy practice, Sir started his career with a family-owned pharmacy in the year 1989 called the most successful pharmacy store of India. Sir's pharmacy is considered as model pharmacy of India, named Hindu Pharmacy, located at Panji, Goa, India. Sir introduced the concept of patient care and point of care testing of a pharmacy for last 2.5 decades, which is out of service for 25 to 30 years. Sir has worked as project leader in FIP IPA vaccination project for pharmacists in India. Into it, diploma, degree, and PharmD students pan India have participated and given their contribution and learned towards the vaccination. Sir is the editor of IPA Community Pharmacy Division E-Times on it's the official bi-monthly publication of Indian Pharmaceutical Association. He is an observer on the executive committee, which is Community Pharmacy section of the International Pharmaceutical Federation for the tenure of 2 years from 2024 to 2026. He is a president, Goa State Pharmacy Council. He is a core team member for framing GPP guidelines in India and developing the GPP training manuals. Project leader for project on good pharmacy practice in collaboration. He is a major contributor towards writing on GPP training manual for community retail pharmacists and a resource person for lot of CMEs for training workshops for pharmacists, core team member of various activities of IPA, campaign for awareness on responsible use of medicines, and a lot activities and allocates to such experience and credit. He is involved actively in training practicing pharmacists across country. Not only sir is a passionate practicing pharmacist, but also a good human being and researcher. With both folded hands, I welcome to you, sir, onto the platform of ISF College of Pharmacy.
Thank you.
Our whole team welcomes you. And, sir, now over to you, the session. I hand over this digital platform to you. Thank you once again, sir.
Thank you very much, Dwivedi ji. Also, thank you to Dr. Saurabh and to the whole team of ISF Moga for organizing this wonderful 7-day session. And the topic was of great interest to me also, good pharmacy practices. This is the concept that we introduced more than 2 decades back. And I shall give you a brief overview of that. I shall also try and give a brief overview and encouragement to the students in the practice setting, because we have a lot of challenges, and that's the topic title of my presentation, Good Pharmacy Practices, Challenges to Overcome. So without challenges and without hard work, we definitely cannot succeed. And over the last so many decades, so many people have collectively been working. And that is why little by little, the pharmacy profession, the practice part of the pharmacy profession has moved forward little by little. We have a very long way to go. And that is why we want everybody to come along with us. And of special interest to me is the young pharmacists, because they are the future. It is them who can make the future for us. We can only try at our level to guide and push them, motivate them. But it is, according to me, it's the young generation who has to take it forward. So good pharmacy practice is something which is beyond legal compulsions. You have to follow the law, definitely. And good pharmacy practice is one follow the ethics, the morals, and induce professionalism into do in your day-to-day practice. Most important. So GPP was first by the FIP for hospital and community pharmacy settings in 1992, and this was endorsed as a joint statement in 1997 by the WHO. So good pharmacy practices are intended mainly for pharmacists in developing countries so that they achieve good pharmacy practices. These guidelines are useful for national associations and national authorities and relevant bodies to build on this. GPP is the base on which our practice and professionalism can revolve around. So we need to have the relevant documents and build up our laws and regulations, because as we know, our Drug and Cosmetic Act is quite old and it's not upgraded, kept updated as per the practice settings. So that needs to be done on the basis of good pharmacy practices. So GPP provides specific achievable roles and functions so that we can all fulfill the mission of pharmacy practice. So GPP is adopted by a whole lot of countries in the world, and many countries have gone many steps beyond GPP and professionalizing in so many different aspects. So this is a simple definition: the practice of pharmacy that responds to the needs of the people who use pharmacy services. So we have to provide optimal and evidence-based care to our patients. That is the true meaning of good pharmacy practice. So these guidelines were updated in 2011 by the FIP based on the feedback and the discussion and experience of the previous 2 decades. And this is where we stand now, and we continuously have to take things forward from here. So the main elements of GPP are health promotion and illness prevention. This is again a very core area for pharmacy and pharmacists. Supply and use of prescribed medicines and other healthcare products, including medical devices. Self care, pharmacists play a big role in this. Influencing prescribing, influencing prescribing for other pharmacies as well as for other healthcare professionals, and rational use of medicines. So GPP, please remember, is a one step above the laws. We have to follow the laws and the regulations, and one step beyond that, and many steps beyond that, is GPP. So in the Indian Pharmaceutical Association Community Pharmacy Division drafted Good Pharmacy Practice Guidelines in 2002. This was a brief contents of that. As you can see, we have structure guidelines and process guidelines. Structure guidelines talk about the various different policies, what are the things needed in a pharmacy, whereas the process guidelines, as you will see, talk more of professional things. Of course, beyond the inventory and storage management, which are of course very important, the core areas of pharmacy are handling of prescriptions, how professionally we can handle them, how we dispense prescriptions, and more important things also, patient counseling, keeping medication records, self-care, promoting health, pharmacovigilance. So all these things are imbibed in good pharmacy practices. It is just how we take it forward, how we adapt and take it forward. And this we followed up by making a GPP training manual in 2005 along with the CDSCO and the WHO. And with these training manuals, we conducted various trainings all across the country, and we continue to use this manual. All of you should have a copy of the Good Pharmacy Practice Guidelines as well as the manual, because we have tried to make it very simple and put down various things which would be very useful when anybody works in a pharmacy, whether it is a retail or a hospital pharmacy. It is necessary to develop GPP training manual for hospital also. Of course, if somebody can take up that activity, we did this exclusively for community pharmacies. Uh, a lot has changed, so we do need to upgrade this, but I think the basics are strong and they still apply today. So key takeaways from GPP is that GPP is essential for patient safety and optimal medication outcomes. So we need a lot of different stakeholders to work together on this, whether it's the regulators, it is academicians, the students, the practicing pharmacists, the researchers, all need to come together and take this forward. So the strategic focus areas for GPP are the patient-centered pharmaceutical care delivery. Another thing which is very important and which you also are doing is continuing education and professional development. We need to continuously upgrade ourselves. Then we need to have technology in our hands, which is very necessary. And of course, you all are very savvy with it. And we need to strengthen the regulatory enforcement. This is also very important. So the future of pharmacy practice, as I said, lies in you, and it is you and me. If we embrace pharmaceutical care and put the patient's welfare in the center of it, then we can definitely achieve this. If not today, a few years down the line, definitely. Of course, we are doing so many things. We need to do plenty more things if we have to achieve those levels of standards. So we have the backing and supporting of the patient practice, pharmacy practice regulations of 2015 of Pharmacy Council of India, and that gives us enough backing, enough courage and rights to practice pharmacy. So this is a definition. I'm trying to make it simple: interpretation, evaluation, and implementation of medical orders and dispensing of prescriptions. Second thing is participation in drug and device selection, drug administration, and reviewing drug regimens and research related to drugs. So this encompasses what we as pharmacy practitioners can do, and of course do many things beyond this. So the PPRs also have defined for the first time in India pharmacy practitioners, and pharmacy practitioners are those pharmacists who are licensed under the Act and who counsel or otherwise administer drugs in the course of professional practice. And all of you should, if you already have not, go through the pharmacy practice regulations. They are our new guide so that we can practice pharmacy in that way. So these are the four different types of pharmacies which are defined in our country. Earlier, this was not there: community, hospital, clinical pharmacists, and drug information pharmacists. So we have enough strength and backing in pharmacy practice to go forward and do our best. Now, I will come a little step below. I'll explain to you why this is important. See, pharmacy practice in India is not all that rosy, whether it's in hospital or community. What is important that you should know about it. So the ground realities and challenges are real, and it is people who are actually practicing on the ground who understand what we go through in and out, day in and day out, and across the country. The biggest problem that our country faces is the presence of a pharmacist in many of the pharmacies. The pharmacist is not always present in many of the pharmacies, and this situation is bad in some of the states. Some of the state situation is good, but this is a basic law. Unfortunately, the law is not implemented properly. This is one big lacune for pharmacy practice in our country. The second one, which is related and also important, is the availability of prescription medicines without a prescription. Many of the time, in many of the places, these are available, and unfortunately, this is also backed by advertisements, deep discounting. So, what has happened in many places that medicines have become a commodity, like a kirana store. This is something which is bad, and this is again where implementation of the law is very poor. Then we have a lot of commercial challenges. There is a lot of competition. There are too many pharmacies, many of them too close to another, cutthroat pricing war. There are demands from many of the associations many times to that pharmacists are not needed at all. So these are definitely drawbacks. The other things are drugs and fixed dose combinations. We in India have more than around 5,000 of them. So more the drugs, the more difficult it is to remember, the more difficult it is to handle, to stock. Because if you see the number of brand names in our country, or they're called as the stock, not only 2 to 3 lakhs, they may be even more, and nobody knows the exact numbers. Then how much can a pharmacy stock? The pharmacy is very small. It may stock only a few thousand medicines, but which one the doctor will prescribe? At the same time, generic substitutions are not allowed. And we in India also do not have a guarantee of generic equivalency, which may give the confidence to substitute. Then, of late, you may have heard plenty. In a lot of regions in the country, there is availability of counterfeit or spurious drugs and not of standard quality medicines. So these are all great challenges. The other challenge is that recognition of pharmacists by the people, the professional atmosphere and inputs in the pharmacy and many of the educational institutes is not adequate. There is inadequate knowledge and skills to handle patient queries. But the pharmacists have not been professionally developed in that way in many of the places. And that is why they don't have that confidence. And once that happens, it is once you begin practice, it becomes very resistant to change. Now you may have been seeing this ad over last few years, plenty of this type of things. discounts online, available by postal delivery, courier services. These are very common, popping around everywhere on the television, on your mobile. Again, here there is a very poor implementation of law, because I think India is the only country where online pharmacy, there is absolutely no regulation on these online pharmacies, and online consultation, e-prescriptions, they continue to happen. And as a result, what has happened? See, over the last 2-3 decades, a lot of efforts have been put by so many people in pharmacy practice, doing starting M.Pharm pharmacy practice, then B.Pharm pharmacy practice. Then so many associations have been pushing professionalism, training of pharmacists, and we slowly started shifting from a product oriented to a patient oriented focus. But what has happened in the last few years, it looks like that we are going back to product oriented. Everything is seems to be becoming commercialized. Medicines have become a commodity, and it's looking like crass commercialization, which is very dangerous for the profession. Talking a little about hospital pharmacy, for example, in the public sector, a sufficient number of posts of pharmacists across the country are not being created, as many needed in all these health centers. Then created posts, but not sufficiently filled. So when the pharmacists are not there in many of these centers, then who is dispensing the medicines? It is obviously somebody else, maybe the nurses, maybe the ward boys, or maybe the sweepers also. And availability of essential medicines is a problem. And appointment of pharmacists for clinical roles, even though it has been promised, it has not happened in the public sector. Luckily, in the private sector, many of the hospitals, especially the tertiary hospitals, the super specialty hospitals, the corporate hospitals, are hiring clinical pharmacists, both PharmDs as well as M.Pharm in pharmacy practice. So this is a good sign. We need to keep pushing. We need to keep advancing. Now you might be wondering why I'm telling you this. Okay, so now this is another thing. These are the Indian Public Health Standard. These are the guidelines created by the Ministry of Health for health centers, community health. This one is for community health centers, primary health centers, sub-district hospitals, sub-centers. But unfortunately, in these guidelines, which have been revised so many times over the last decades, the role of the pharmacist is not described. So you might be saying now that in the last few slides, I've been talking something which is negative. So आप कहेंगे कि ये क्या कह रहे हैं? He's come here to motivate us or demotivate us. The actual fact is that we need to know, because we are trying for identity. We are struggling to be identified. We want to be recognized as a profession. If we want to do that, we also need to know why it is not happening. In USA, UK, and many of the developed countries, the community pharmacy, clinical pharmacy, hospital pharmacy revolution started in 1970s. Whereas in India, you see, the father of the pharmacy education in India, Professor M.L. Shroff, he had predicted in 1970s that India will soon shift focus from product-oriented to patient-oriented. Unfortunately, he passed away shortly after this, and we have not been able to get to that dream that Professor Shroff had envisioned. We have done some progress, but there is a long way to go, and that is why I have shown to you what are the lacunae, and it is you and we and me and all of us that need to do something about it. We have to all strive to fulfill this dream. We want pharmacy practice to flourish in our country, the pharmacy profession to flourish, and the name of the pharmacist to be valued and respected in the profession. And that is why I'm telling you this, so that because staying silent is not an option. You, even as students, need to not only start thinking about it, but need to start acting upon it. So that is why I have provoked you. I have told you the facts and deficiencies. You need to know about them, you need to speak about them, and then we collectively need to uh, tackle all of them. We need to implement all of these things, because changing these things bit by bit will improve health outcomes. It will improve the image of the pharmacy profession, And what is also important is for young pharmacists that what will you do after graduation? That thought must be always worrying you. So if pharmacists are available at the grassroots, in hospital pharmacies, in community pharmacies, where presently they are not, they should be there, but they are not. So that if we do this, it will automatically increase our job opportunities. It will automatically increase placements for pharmacists. That is why it is important that you, even though as students, you need to step up. Of course, now I told you many bad things. Now let us look at a few brighter things which are happening in the country. I will initially show you some things in the community pharmacy. So this was a patient counseling course which was begun in 2007 in Mumbai and Maharashtra, where those who are already practicing community pharmacists, their age were anything from 20 to 60 with plenty of years of experience. They underwent this course, and several batches of these have come out, and even now several batches of pharmacists are being trained in such type of courses by the Maharashtra Council and a few other areas. Now, out of this, the pharmacists started realizing what is their true potential, what is their real role. So, in the next many slides, I will show you some examples how these pharmacists have evolved, how they have changed. Many of them, especially after this course. So, this is Mr. Sagar Kulkarni from Kalyan. He's having his own pharmacy, uh, the B Pharm qualification. After the course, he started implementing good pharmacy practices in his pharmacy. So, these are the slides which he has made. So, he made modifications in his pharmacy, separate area for patient counseling. He put up health information display for patients and reading. He started doing many other activities like being a pharmacist dots provider. He had a library, doing demo services, doing nebulization services in his pharmacy, doing peak flow meter checking height, weight, doing blood pressure measurements of his patients, conducting health camps, so that the patients will benefit and people will know about it. Education through videos, providing patient information leaflets, doing diabetic neuropathy checks in his pharmacy once in 3 months. This he does every Sunday, calling his patients, regular patients, to the pharmacy to check their health, blood pressure, and blood sugar levels. So these are pharmacists who are motivated and bringing about a change in society. Pulse polio happens in his pharmacy. Nebulization services he does. This is another pharmacist from Panvel, also from Maharashtra. This is a small pharmacy, but he has made maximum use of it to provide patient inputs. So the use of the internet to provide patient information on different aspects through video, doing patient counseling at the counter as well as inside, doing blood pressure check, blood sugar checks, how to use insulin pens, inhalers, demos of different devices. He has created his own leaflets on different aspects to give to his patients in local languages. This is another pharmacist in Fonda who does regularly health checkup camps for his patient blood pressure, blood glucose, cholesterol levels, and using pharmacy students to provide counseling to the patients, blood sugar checks, peak flow meter use to detect early asthma. And this was from a project of IPA in Maharashtra, where pharmacists were trained to be DOTS providers, and so many pharmacists uh, were DOT providers and provided TB medicines to their patients. This was a successful project of Indian Pharmaceutical Association. Now, these pharmacists, and of course, there are many other pharmacists. For lack of time and lack of number of slides, I've just given you few examples. There are many who got motivated from the courses and are doing such similar activities in their pharmacies. So all of these pharmacies have got the feedback of increased business, increased professional satisfaction, acknowledgement by public for the work that they do, and thus they are motivated to provide more services. So these pharmacies were already working. They were working for 5, 10, 15, 20 years. And this is after then they got trained. So they were D farm or B farms. They got inspired by this. They were and not so tech savvy. They were not enriched in clinical skills, but during these sessions, they realized what their potential is and implemented it. I'm not saying all of them implemented it because so many of them were trained. There were so many of them who made the difference. Now, coming to you, you are the next generation pharmacists. I just showed you what the past generation, how they picked up and how they made changes. So you are brought up in a tech savvy age. I think you are almost brought up with all of you with a mobile in your hand, right from you're born. So you have finger information at your fingertips, and you have plenty of opportunity to get exposed and trained in clinical skills. Right now, during your curriculum, and after that, because curriculum is not the only thing. You must go beyond the curriculum because curriculum has its limitations. Teaching has its limitations, but learning does not have limitation. It is up to you. The more you want to learn, you can learn. Now, these are few more examples of these are chain pharmacies started by pharmacists. This is in Coimbatore. They have 80 plus pharmacies now. This is a big chain of pharmacies, which is again very professional, very good atmosphere there, doing patient counseling and doing various other health activities. This is another in Coimbatore and Tamil Nadu, started in 2007. Pasumaya, the professional look of most of their pharmacies. They are providing patient counseling services and other medical devices services, conducting health screening services. So a lot of health professional activities are being done by these pharmacists. So this is the pharmacy where I work. This is a 100-year-old plus pharmacy, and we also do a lot of professional activities. This is our patient care area. For more than 25 years, we are having this, where we do blood pressure check, blood sugar checks, uh, BMI, providing counseling on nutrition, on so many other things, providing leaflets, referral to doctors, handling minor ailments, and we follow good pharmacy practices. And this is how it all helps us to maintain all the records so that we are always up to date, and our pharmacists are trained. Our non-pharmacist staff is also trained to be updated. These are several of our patient information leaflets which we have made in simple languages, easy to understand for the patients. Days, weeks, months that we conduct throughout the year so that patients are aware of various health related activities. And this is a next gen pharmacist. This is Tilak from Hyderabad, and he is an Australia returned. He did his B Farm over here, went to Australia, practiced there, and he's come back. And he, I feel, is one step beyond all the other pharmacists because he is playing the true clinical role. And if you happen to be in Hyderabad, please do take an appointment and visit him. In the meanwhile, you can always look at his website. And this is him and his wife who run this pharmacy in a very professional way. And they dispense medicine with personalized labeling and patient counseling. They do medication management review for their patients. They have labeling for the dispensing that they do, personalized labeling. They have labeling in different languages depending on the need of the patient. Smoking cessation services. They maintain medication profiles of the patients and also provide guidance, written guidance to patients how the medications have to be taken. They put cautionary labels on the labels of the medicines that they dispense, blood pressure measurements and consultation, blood sugar measurements, consultations. So a lot of good professional work is happening over here. Now coming back to pharmacy education. Pharmacy education in India is mixed, multi-matched, and different types of grades of professional, different expertise of professionals come out. DPharm is just 2 years of practice, not exactly sufficient to be real hardcore practitioners, but that doesn't stop anyone because learning never stops. Many of the pharmacies who are doing professional work that I showed you, they are DPharm, but they have picked it up. Then there is BPharm pharmacy practice, which is there in a few institutions for those DPharms who want to specialize and get a degree. And our B Farm is industry oriented. Most of the focus is industry oriented, and very less on clinical aspects and practice aspects of it. But that does not stop a B Farm also to do practice, because basics are there. What one needs is additional professionalism, learning, and today learning is unlimited. Plenty of information is available all across. Then we have PharmDs and MPharm pharmacy practice. These two have clinical strengths, so they are more clinically oriented, and these are the ones who can definitely deliver pharmacy practice in a much better way, because they're trained to do that. So, what is important is that pharmacists ideally should be groomed well in their college days. Of course, if that does not happen, if there is some deficiency, then of course it's up to the students how the student would like to take it forward. Because these are the main years where the student pharmacists can be trained and matured. Because once the foundations are good, the other things come out better. It's not always the case, of course. Then coming to getting into the practice settings. See, if somebody has done B Farm, then there are two options ahead of them if they want to specialize into practice. One is the M Farm pharmacy practice, which is available for 2 years, and many colleges in the country are offering these services. This was started somewhere in late 1990s in JSS, Mysore, and Ooty, and it is spread across the country. So for B farms who think that practice is their calling, they can do this 2 year course. And then there is Farm D Post Baccalaureate, which is 3 years after B Farm. This is also offered in many colleges in the country. Now, which one to choose depends on you. What is your interest and how much you would like to yourself to be involved in learning. How many more years you would like to spend before actually starting off. So finally the choice is yours. We can only show you the options. We can only guide you. The choice of the college, choice of the location. You need to do a little background search, and also you need some luck. Also, you need to decide whether you would like to do it in your place or you like to move out and choose better colleges. Now, these courses for practice, these are actually the bridge between pharmaceutical knowledge and clinical applications. So, practice and clinical applications is what is strengthened when you do these courses, and there is growing demand for such practitioners in Indian hospitals, industry, as well as research, because it's not just practice. These courses groom you for clinical research, regulatory affairs also. Then there is focus on patient-centered care and evidence-based medicines. That is why this is the strength of these two courses. Now, in these courses, you will get, besides the other things, the practice-oriented things. What I have listed out is focus on clinical pharmacy, pharmacotherapeutics, pharmacovigilance and patient safety, evidence-based medicine, and research methodology and biostatistics. So these are also very important. Research in pharmacy practice is also very important, because it is a building block. It is an evidence building block, and along with theoretical exposure, practical exposure which you get when you do these courses is exposure in the drug information center, going on hospital rotations or ward rounds, case discussions and patient counseling sessions, research projects and dissertations. So this practical exposure also gives you that hands-on thing, and when you actually do it, you definitely learn better rather than just theoretical. So now these are the skills that you will develop when you do such courses: clinical skills, assessing the patient, reviewing the medication of the patient, doing therapeutic drug monitoring for specific drugs, and developing communication skills, which is very important, and it's a core for patient counseling, and collaborating with other healthcare providers, that is the doctors, nurses, and other healthcare team in the hospital or in the clinic. And developing of analytical and research skills for data analysis, clinical audits, research writing, which can then take you to clinical research and other fields, vast fields and vast requirements of such professionals is there. Then the development of soft skills, because hands-on when you are actually doing this, talking to patients, you learn about ethics and leadership skills. So there are a lot of job roles and career pathways for these clinical pharmacists, clinical and hospital roles. So as clinical pharmacists, as medication safety officers doing prescription audits, an antimicrobial stewardship pharmacist. You can be that's an infectious disease pharmacist. Then there are roles also in the industry, in medical affairs, in pharmacovigilance, in regulatory affairs, and then that is of course for teaching, doing clinical research, and coordinating research trials in the government and public health sector as policy advisors in national health mission projects. So the opportunities are plenty, and of course in community uh, pharmacy, there are PharmDs and there are those who have done MPharm in pharmacy practice. They are also, many of them are started their own pharmacies or they are working in pharmacies and providing professional health services to their patients. So I've listed a few roles for practicing pharmacists, whether it is in the hospital or in the retail. Professional dispensing, checking prescriptions, patient instructions, providing counseling, putting dosage and ancillary labels, providing patient, developing and providing patient information leaflets, handling common ailments, also called as minor ailments, and tackling them with either non-pharmacological therapy or OTC medicines, access to patient medication records, monitoring of ADR and drug interactions, doing medication therapy management, providing drug information to healthcare providers as well as patients, independent prescribing. Some of these things we may still not be there, but we are going there because these are some of the things which are well developed in many of the developed countries where pharmacists are deeply involved in doing this, and doctors have gladly allowed pharmacists to do independent prescribing, do medication therapy management, handle common ailments, provide screening services, do tobacco cessation services, then pharmacists as vaccinators. Worldwide, in at least 50 countries, pharmacists are vaccinating. We in India, just last year, have started this training and we have trained 85 master trainers, and we are in the process of training more pharmacists to be vaccinators and running diabetes clinics, hypertension clinics, and also an important part is research in practice setting, whether it's hospital or community or in the clinical settings, and whether it is the academicians who are doing this research or it is the students who are doing this research as part of dissertations. It is very important, especially in community pharmacy, because when you do such type of research in pharmacy practice settings, you will build the evidence. See, so many of us are doing uh, true professional roles and practices, but the only proof that we have is some photos that I am showing, and I am hearing that they are doing. But real evidence can be built when such research is done, which will prove that pharmacists are doing it and how it is benefiting the patients. So this will then automatically lead to steps which can help to improve practice. So that is why I call upon academicians as well as students who are doing their dissertations to think of taking up such topics to do research in pharmacy practice. Now, importance of pharmacy practice in the Indian healthcare is to improve patient safety, reduce medication errors, outcomes, and support rational medicine use. So all these things are the core areas for pharmacy. And many of the times, doctors do not have the time to go into this. So if pharmacists start taking this up more and more, of course, in many of the clinical pharmacy settings in India, pharmacists are doing these things. Of course, we need to increase the number. And if we build that evidence, it will be more easy to take it up. So India is known as the pharmacy of the world. That is because of its manufacturing capacity, drugs and vaccines. But we need to upgrade and upskill so that pharmacy practice also is becomes the pharmacy of the world. Now that is very important for patient safety. And what we can do, as I have been trying to tell you and motivate you, it is collective responsibility of all pharmacy professionals. It's not just those who are in power, those who are in the regulatory, those who are in association. It's also the responsibility of practicing pharmacists and also the responsibility of the pharmacy students. So, next gen pharmacist should be exposed and trained in clinical skills. You should take it up upon yourself. I have repeated this slide so that to remind you that this is what you are and this is how you can take it forward. Information is available in plenty. A lot of information is available on the internet today and free of cost. A lot of associations across the world are providing a lot of free services, free information, and this is one of the handbook developed by the WHO and FIP, developing pharmacy practice. Again, available free of cost on the internet. Do go through it. So next generation pharmacists, last few messages for you. You should be ready to take on challenges, make the change happen. We are banking on the young generation. India has the largest number of youth in the country, and we also have the largest number of pharmacy professional youth in the country. Every year, more than 1 lakh are coming out. Make the change happen. There is a lot of scope and there is a lot of need for interventions in India, and skilled pharmacists are necessary to get into all these things, because these are the problems and these are the problems of the future also, especially the chronic diseases. They're going to be the number one killers. Another number one killer is going to be antimicrobial resistance. So we need to all work together for this. So whether it is asthma, obesity, diabetes, hypertension, cardiovascular disease, tobacco cessation, nutrition is a big area. You can specialize in any of these things. You can play a very important role in so many aspects. So it is the youth that has the power to change, and young generation is definitely our future. I very strongly believe in that. And there's a lot of information available. YouTube, even I myself learn so many things from YouTube. Need to get a lot of information on pharmacology. A lot of OSCEs are there for pharmacists on the internet. Then a lot of practice demos and plenty of webinars are available and free of cost. In the past, thanks to COVID, we have so much of free learning available. We need to decide what to pick and choose. We need to decide what we want to learn. This is FIP's information available on the internet. This is also freely available on the internet. We need to reach there. Community pharmacists, hospital pharmacists for medication therapy management in our country also. So we need to learn from other countries, but we need to adopt, because we cannot copy paste directly everything from other countries. So how pharmacy practice works in other countries is very inspirational. I myself was inspired by reading the pharmaceutical journal uh, 40 years back when I was doing my masters. So that itself was inspiration, and that led me to dig more and more and learn more and more. That time things were difficult to get information. Today everything is available on the internet. So what they do is inspirational. We may not get there very soon, but we can definitely pick up good things from there. I myself have picked up so many things, and I have learned so much from them, because we need to address the problems of in the Indian community, and we need to care for our uh, patients in our pharmacies. So you need to keep in touch with what is happening. Pharmacy practice news. Again, this is easily available across the world. A lot of free bulletins. Make good use of social media for learning, for connecting. Twitter and FB, Facebook or Instagram, you definitely use it for your social things, but also use it for professional work. What is happening? Connect with professional people, and that can take you forward. So whether you are studying or you are working, always dedicate a fixed amount every day or every hour, few hours, dedicate to improved learning, because time is precious, and you will never realize when you finished your 4 years, when you finished your youth, and tomorrow is always difficult to learn today, start from today. So latch on to a mentor, any faculty or any pharmacy practitioner or any pharmacy professional, or from any association. Get yourself mentored. This is most important, self motivation. We are here to guide you and tell you so many things. It is up to you how you what you grasp and how you pick it up. Because the teaching environment may not give you everything, because there are limitations. Curriculum has its limitations, time has its limitations, and spoon feeding cannot be done for you. Teaching academia can guide you. It is up to you how you develop it, how you grasp things, how you learn, what efforts you make, and what is your inclination and determination. Finally, it is up to you. So you be equipped to handle all these things. There are just a few things you know by now what needs to be done. Irrespective of what inputs that you get, it is in your hands to make your own destiny. Don't wait for somebody else to do things for you. That is why I keep telling, whether it is the regulator, whether it is the Pharmacy Council of India, whether it is the big associations which are there, whether it is the so many big leaders, ultimately it is you who can make your destiny. All of these can guide and make things a little easier for you, but you have to make your own way. And that is what I feel. Each one has to do something to bring about a change. I tried my best, I continue to try my best, and I hope that you also do your best. Thank you.
Thank you so much, sir, for this wonderful talk. And it was enlightening one, and it covered the all prospects of pharmacy practice right from post-independence, how the pharmacy has shaped up in India, and now with the next generation pharmacists with the globalization, and since the perception of clinical pharmacy practice with master's programs into the scenario in 21st century covering PharmD, PV and M-Pharm pharmacy practice, B-Pharm practice, a bridge course rangely covers a lot of clinical activities, patient care, communication, clinical communication particularly, pharmaceutical care, evidence-based medicine, on-time therapy, medication adherence, and the vaccination program which was conducted by IPA and you was one of the greatest initiatives taken in the recent era. So congratulations to sir, to you and to your team. And it was a wonderful initiative for family graduates all India, which
Mhm.
took as one of the ignited initiative. Moreover, pharmacy practice regulations came and all the things came up, and now the question there are two or three questions which came up in the YouTube which I saw. One was related to the medication errors. So that the person is asking as a participant is can we compulsory make this computer operated physician entry? It means handwriting for the so comments on to that sir for yours.
This ideally it should be. It has to be an effort of everybody. And so many medication errors. Reading of the prescription is such a nightmare, even for everybody, irrespective of how much experience you have. It is definitely a nightmare, and slowly we have to push for that. Otherwise, it's going to be a lot of problem. Luckily, the India has moved to digital, but many doctors have moved to digital. But unfortunately, I think a large majority has not moved. So we need to consistently push. For example, we at the IPA, me at the personal level, I have written to the health ministry to make that change happen, because today is the era of electronics and the digital era. And even fake prescription, bogus prescription, we encounter many times. And writing is definitely a problem. So collectively, if everybody pushes, I hope it will become a reality soon.
Yeah, sir. Hoping for the best. So this computer operated physician entry. And sir, another one question is regarding the job role of clinical pharmacist as per NABH standards in the NABH accredited hospitals, in the corporate hospitals. So the growth factor of the clinical pharmacist at initiative level, they got a good ice breaking package. But when it comes to the acceleration phase, so the growth of the clinical pharmacist.
Yeah, that needs to be there needs to be proof of concept. One is through practice, research, and building evidence. How clinical pharmacists have proven to be useful in many hospitals, they are much sought after. Many of the doctors are leaving many of the things for clinical pharmacists to do. They say, "You handle this. I cannot do this by myself. If you are on leave, I am missing you." These are the things which are the evidences which need to be grasped. Secondly, we have so many PharmD colleges, and that besides the evidence, there also needs to be more consistency so that the students are really trained appropriately. So that, and secondly, the hands-on experience. So clinical experience is also necessary. So if the student has the interest, student shows the interest, and if that hands-on experience is available to the students masters that, then he can get that confidence to prove to the medical profession that yes, this is our work. Only when they see it, they will automatically ask you to do those things. So that part I feel is missing. I think too many family colleges have come up. Probably quality is an issue. This is what I have heard, and maybe this is one factor. But I think where the quality is good, where there are many pharmacy uh, colleges and medical institutions where they're practicing, their rapport is very good. The doctors wait for pharmacists to come. The doctors allot pharmacists specific responsibilities so that their burden is reduced. So if we have more of such occasions and more of such evidence, slowly it will take time.
Yeah, sir. On-job trainings are the requirement of the hour, and by an individual pharmacy professional can grow by real-time experiences. Beyond curriculum is one of the requirement in curriculum. Definitely, the things are there to bridge that gap, which are the current practices. Either it is community setup, hospital setup, or online or generic drugstores. So we have got sir lot of good comments on the YouTube live chat, like sir, excellent session, mind blowing session, and updated session. All the pictograms were used and the evidence things. The presentation was so smooth. Came to know about all the progression of pharmacy from healthcare 1.2 to 5.0. So, sir, in the end, I would like to thank you on behalf of Department of Pharmacy Practice as a College of Pharmacy for taking your time from out of your really very busy schedule and forecasting as the real pharmacy practice time of India. And sir, kindly accept this e-certificate from our side. Let me share the screen, sir. So thank you so much, sir, for your
Thank you.
session. And we are glad to have you today here, sir. And definitely in the upcoming time, uh, we are happy to have you in person also, sir, for some induction, orientation, or community pharmacy education programs. So I would like to thank you, sir, once again. And my thanks goes to our IT team who did this wonderful YouTube live, Engineer Parneet Kumarji, and the coordinator, Dr. Khadagraj and Dr. Madhav Dwivedi ji. So, sir, thank you so much, sir, for
Thank you. Thank you.
thank you, sir. Regards. Thank you, sir.